Glaucoma is the second leading cause of blindness in the world. And during the month of January, groups and organizations across the country are using National Glaucoma Awareness Month as an opportunity to educate the public about this blinding disease and to get comprehensive eye exams. Here to tell us more is Dan Mines, ARNP with Escambia Community Clinics. Thanks for being here.
Thank you, Jeff, for having me on today.
Well, before we get into this conversation about our topic here, tell us a little bit about the clinic.
Well, Escambia Community Clinics, not the health department, which a lot of people confuse us with just because of the name.
Thank you for pointing that out.
Was born out of the closure of University Hospital, which was a state-run hospital that provided for the uninsured in our county. They closed in 1992. We opened in 93 to see patient care at the corner of Palafox and Maxwell. Since then, we've grown to a total of 7 clinics throughout Escambia and Santa Rosa County. And we have 22 healthcare providers, about a 50-50 mix between physicians and nurse practitioners such as myself and physician assistants.
Great.
This year we're looking at seeing about 27,000 patients and 75,000 visits for 2012.
That's a lot of people you all are serving. So
yes,
it's
sir.
A valuable resource to the community.
Our mission is essentially to provide health care for the underinsured, uninsured, and medically needy. So we're willing to see anybody, but our main focus is making sure that everybody has access to primary care.
Great mission, great mission. So let's get back to glaucoma. What is glaucoma?
Glaucoma is what we call the thief of sight. It's a slow progression of blindness caused by increased pressures in the eye. Basically, 2 parts of the eye. You have the ciliary body in the back of the eye that makes fluid to nourish and support the eye structure. And then you have a meshwork in the front, the trabecular meshwork, that drains the eye.
Okay.
Well, in glaucoma, you get proteins clog the meshwork and therefore increased pressure, which damages the optic nerve. So it's more of a plumbing problem.
Okay, it's a great way to explain it.
So,
well, are there various types, or is it like a one-size-fits-all, or are there different
yes, sir.
types?
There are various types. You have congenital glaucoma, which means you're born with it, and one in about every 10,000 births. You have a normal pressure glaucoma, which is only detected by, dilated eye exam. And then you have the most primary cause, which is open angle glaucoma, which is where the area between the cornea and the iris is wide open, yet your eye produces too much pressure because of the meshwork being plugged up, so therefore the plumbing problem again.
Well, what kind of symptoms do people come, if they were to come to you or someone else, and what kind of symptoms might they be experiencing that would lead you to test them for this?
With open angle glaucoma, the scariest thing is it's asymptomatic. There are no symptoms. People may notice a little bit of vision loss in the periphery or off to the side, but that's about it. So it's just that slow progressive blindness from the outside to the inside.
So how is it detected in someone who's having really no symptoms?
A lot of times the first thing some people will notice is they'll have to turn just slightly to see off to the side. And that may prompt them to seek care. But mainly it's by the ophthalmoscopy or the dilated eye exam through an ophthalmologist.
And how often do y'all recommend that people have those exams, and at what ages, especially, say, older adults?
Well, as far as older adults, depending upon if you're at high risk for glaucoma or have glaucoma, then it's every 6 months to a year.
And you mentioned risk. What are some of the risk factors, or certain populations more at risk than others?
The major risk factor is age, because it is a disease of aging, so we look at mostly in people over the age of 60. Although people of African and Hispanic descent have a higher rate of this disease, and it usually occurs a little bit earlier, like 40s and 50s. So the key thing is if you're over 60, you should get the eye exam done. And if you have glaucoma, since it is partially hereditary, tell a family member so that they can get their eyes examined too, because we do eye exams starting around age 35 for this condition.
Okay. Well, what kind of treatment's available?
Treatment options there's basically 2. We have medicated eye drops, which basically decrease the pressure in the eye, and that's usually the first line of treatment. And then after that, there is also laser surgery, just in case that the eye drops do not work.
And what kind of feedback do you get from patients on on this experience and how they're doing with these treatments?
Well, with the treatment, unfortunately, a lot of people will stop treatment because I'm putting drops in my eyes, but I don't feel anything. So the key thing with the treatment is to make sure that you take the drops the way your doctor prescribes them so that you prevent further loss of sight, where, you know, that's the key thing with it is just
keeping up with
just got to keep up with what you need to do to keep your eye healthy.
Well, what might be out there on the horizon for, you know, future treatment, or what research is going on possibly that might benefit folks with this problem?
Currently, there's some genetic research going on because there's a protein in the eye called myocilin, which a mutation of it has been found to plug the eye's drainage system. So therefore, they're looking at new drugs to prevent that. But again, when you're looking at glaucoma and prevention of loss of sight, the only treatment right now, or the best thing for it, is the prevention part, which is getting the eye exam done.
Well, tell me a little bit about the exam. When we mentioned that in the lead-in about, you know, the importance of getting this comprehensive eye exam, what does it entail?
Well, there's several eye exams that they do. One of them is tonometry, which is where they actually check the pressure in the eye to see if you have a high pressure, which causes the glaucoma, versus having a normal pressure. Then there's the dilated eye exam, where they'll put some eye drops in your eye, dilate the pupil so that they can look in and look at the optic nerve to see if it's damaged or not, see if it's healthy, you know, the right color, the right shape. Then there's perimetry, which is a testing of the lateral vision. As we said, you know, the glaucoma is a loss of peripheral vision, so they check that also.
Great. Well, that's great information. If somebody wants some more information or to find out more about the clinic, what should they do? Who should they call?
Well, we do have, you know, our regular standard line, which is 436-4630. We do have the website, but the best site for glaucoma would be www.glaucoma.org to access more information on that.
Great. Well, thank you very much. We appreciate it.
You're welcome.
And we'll be right back with more Coming of Age and Car Fit, a program for older drivers.